Hi, my name is Joel Chavez, and I'm going to be showing you how to insert an NPA. So NPA stands for nasopharyngeal airway. So first thing you want to do is verify the physician's orders. So why was an NPA ordered? NPAs are used in semi-conscious patients that have a need to establish an airway, but can have some sort of trauma to the airway, so you can use a nose. As well, if a patient needs constant suctioning, an NPA can be put in place. The only real contraindications to NPAs would be if the patient has damage to the nose or they're bleeding heavily, then you would not want to use an NPA. So after you verify the physician's orders, you can check the patient's chart, and that should tell you why this patient might need an NPA, or it can also give you the contraindications. It will let you know what you should expect when you go inside the patient's room. You want to gather your equipment. So here we have NPAs from various sizes, so it's a good idea to take multiple if you don't know anything about your patient. It's a good idea so you're prepared for any situation. Once you gather your equipment, then you can walk in the patient's room, wash your hands, introduce yourself, get their first and last name, date of birth, check their medical record number, and explain the procedure. So you're going to want to state to your patient that what you're going to be doing. So you say, "Sir, I'm going to be inserting a nasopharyngeal airway. I see you have a lot of mucus accumulated, and we're going to need to suction you often. So we're going to go ahead and just put in an NPA." And if the patient's family's there, you can also explain to them there shouldn't be any real risks. I'm going to be with you the whole time, and it might be a little bit uncomfortable, but we're going to put some lubricant on there so it feels less uncomfortable. Once you got the patient's consent, then you're ready to begin. So you're going to want to grab your gloves, and just like an OPA, you're going to want to measure your NPA to make sure you have the correct size. So for an NPA, you're going to measure from the tip of the nose to the bottom of the earlobe. And it's also important to choose an NPA that has an internal diameter smaller than the patient's nair. So this guy has some pretty big nairs, so we're going to use this size NPA, and as you can see, it also fits. So before you begin, you're going to want to lubricate your NPA so it's easier to insert. And the way you want to insert it is bevel towards the septum, and it should just slide in place and lay flush here on the patient's nose. And that's how you insert an NPA. You also want to make sure you take note of the size of your NPA, so you can go ahead and chart that, and as well as chart what time you inserted it. And that's how you insert an NPA.